Health 54 right here on your digital first Pan-African News Network, TOS Television. I am Rose Audu. The Australian capital Canberra says it's going into a snap lockdown after recording its first case of COVID-19 in more than a year. The lockdown was called for the whole of the Australian Capital Territory, home to around 400,000 people, because authorities do not know how the infected person caught the virus. Australia is struggling to get on top of the highly infectious Delta strain, which has resulted in two of its largest cities, Sydney and Melbourne, going into strict lockdowns. A new report by the National Agency for the Control of AIDS has shown that young men and women that have never married contribute 64% of a recent HIV and AIDS transmission in the country. The report also shows that never married women contribute more to HIV infections in the country than men. The Director General of the agency, Gambo Aliu, while disclosing findings of the study in Abuja on Monday, said the never married population, which is the largest source of new infections, is mostly between the ages of 17 to 34 for females and 19 to 31 for men. And in India, Andhra Pradesh, a southwestern region of India, has reported a surge in cases of black fungus, with the total case now going up to 4,597 in the state. In the last 1 week, 151 cases of mucormycosis were reported in the state, along with 14 deaths. According to the Health Department on Monday, there were 225 recoveries during the same time period. To date, 28 people have succumbed to the infection, while a total of 3,492 people have recovered. No fewer than 204 persons have died from cholera in 20 local government areas of Kebbi State. An investigation has revealed that over 2,251 persons had also been hospitalized since the outbreak of the disease in the state. In another development, the Ebonyi State government confirmed an outbreak of cholera in 2 communities in Izi local government area of the state. According to the Commissioner for Health in the state, Daniel Muzirike, the affected communities were Mwimwia and Umbaluku. The Commissioner said a team from the ministry has been sent to the affected communities to assess the situation. This is TOS Television Network, and you're watching Health 54. Still on Health 54, Nigeria has taken delivery of a total of 177,600 doses of Johnson & Johnson vaccines aimed at tackling COVID-19 spread in the country. This is even as states across the country struggle to curb the spread of the COVID-19 Delta variant. The nation is now averaging more than 700 new cases, according to the latest data by the Nigeria Center for Disease Control. The NCDC, which disclosed this via its verified website on Thursday, added that the country registered 790 additional infections on Wednesday, a sharp increase from the 610 cases it registered a day earlier. The Johnson & Johnson vaccines, which arrived in the country Wednesday, was inspected on Thursday by the Executive Director, National Primary Healthcare Development Agency, Faiza Shraib, with some health partners at the National Strategic Cold Store in Abuja. Speaking after taking the delivery, Faiza Shraib reassured that the single-shot vaccines from the African Union under the African Vaccine Acquisition Trust was safe for use like all the COVID-19 vaccines approved by the World Health Organization. And UNICEF, in collaboration with Breakthrough Partnership Project, have trained about 15 case managers on pediatrics antiretroviral treatment in Port Harcourt. Making this known during an exclusive interview shortly after the training, the health specialist, UNICEF Rivers Field Anselm Audu, said the training was aimed at equipping the trainees on skills that would enable them improve the quality of HIV and AIDS ART services offered children and adolescents in treatment sites across Rivers State. The World Health Organization will test 3 new drugs in the latest phase of global solidarity clinical trials to find effective treatment against COVID-19 across 52 countries under the Solidarity Plus program. The treatment artesunate, imatinib, and infliximab were selected by an independent expert panel for their potential in reducing the risk of death in hospitalized patients. Artesunate is currently used for severe malaria, imatinib for certain cancers, and infliximab for diseases of the immune system such as Crohn's disease and rheumatoid arthritis. U.S. health authorities urged pregnant women on Wednesday to get inoculated against COVID-19, arguing that the data demonstrates they do not increase the risk of miscarriage. Rochelle Walensky, director for the U.S. Centers for Disease Control and Prevention, said the agency encourages all pregnant people or people who are thinking about becoming pregnant and those breastfeeding to get vaccinated to protect themselves from COVID-19. According to them, the vaccines are safe and effective, and it has never been more urgent to increase vaccinations as we face the highly transmissible Delta variant and see severe outcomes from COVID-19 among unvaccinated pregnant people. And that is Health 54 right here on your Digital First Pan-African News Network, TOS Television. For more updates, visit www.tostvnetwork.com. Do follow and like TOS Television Network on Facebook, Twitter, and Instagram. And remember to subscribe on YouTube. Do stay with us and enjoy more programs on TOS Television Network. Remember, health is wealth. So till I come your way again, do stay healthy. I am Rose Audu, and many thanks for watching.